had got involved in a car accident, leaving him paraplegic, and he was so weak from his breathing muscles, he needed a tracheostomy to help him breathe. And the amazing thing about, we'll call him Chad, is that he was getting better from a breathing perspective, but was heavily reliant on chest physiotherapy and the respiratory therapists doing their thing to help him push out all the gunk in his lungs and to help with his breathing mechanics. But we're in an era of cutbacks. We're in an era of limiting the amount of support we have, especially on weekends or long weekends. And unfortunately, we walk into a long weekend. And Chad doesn't get his chest physio, and he ends up back on a ventilator. After working so hard to be off the ventilator, now he's back on a ventilator. All that progress, we're now 3 weeks behind, essentially because of what I viewed as short-sighted ism, where we fail to invest on areas that we know are going to have significant benefits. We know the physios, the discharge planners, the social workers, those are the ones that get patients moving. Those are the ones that impact lives significantly. But unfortunately, in more often the first to go when it comes to healthcare cuts. That short-sightedness, the amount of BS I was seeing, that sparked something inside me. I was like, we're going to be part of the solution. I'm going to go get my Master's of Health Administration. I'm going to start a group called the Resource Optimization Network, looking at ways that we can save healthcare dollars and improve the care that we provide our patients. And ultimately, I would say we were successful at producing papers, close to 100 papers in academic journals, but nothing changed. What this highlighted for me, so afterwards we started our podcast, we started to do more work on social media, produce books, and I realized that often these outside the box approaches can be more impactful in terms of creating change and reaching more people than some of the traditional measures. But looking back at this, the ultimate goal was always impact. How are we going to change people's lives for the better? How are we going to improve this system? And Resource Optimization Network did it through the medical lens, but unfortunately, I felt like we didn't lead to systemic change. We start to focus more on the preventative health side. So we had the prevention over prescription, which is still empowering people and giving people the agency to take care of their own health. But to me, that's only one piece of the puzzle. How do we create change, not only individually, but at a hospital level, at a societal level, to really create impact? And I'll give you some sneak peeks of what we're going to talk about over the course of this series. We know our healthcare system is ailing. I recently walked by a patient in a hallway having to have the patient, their loved one, being treated legit in the hallway, which, as someone that has gone through a loved one during a sick time, like that's the last place you want to be. You get calls all the time about long wait times for their imaging, to see specialists. My phone, at least once or twice a day, is getting a message about how do we get through this. And right now, with the